if you want to have a little of time and type on PubMed metaverse, you will find 500 results. If you type augmented reality, almost 6,000 results. But if you type virtual reality, we have a lot of literature regarding this topic. So what does it mean, virtual reality? Maybe two here don't know what does it mean, but I would say again, is a fully immersive virtual environment, a kind of parallel reality in which you are totally immersed, that could have a lot of meaning, for example, in teaching, so for our students, the healthcare staff, for example, to manage different clinical scenarios and to acquire skills, especially in clinic and surgery. But the real, I think, great aspect of this is that you can repeat anytime you want a complex task, and you don't need volunteers needed, and you can perform it anytime because no consumable are needed, and also has a potential in the patient during a procedure, for example, for creating a relaxing environment to reduce anxiety and fear, but also in rehab. So the first thing in which could be used, a lot of universities, especially in US, adopt this method. You can teach your students in more interactive way, not just in the basics such as anatomic skills, anatomic knowledge and physiology, but also in acquiring skills for also ultrasound, for example. But it could be really nice when you teach to your students how to manage a case in an emergency room, and not just to evaluate the symptoms of the patient, the type of procedure that you have to do, but also to join the environment and have a connection with the nurse, with the staff inside. And you can repeat this stuff anytime you want in order facilitate the curve and to reduce the error. I don't want to spoiler, this was a pneumothorax, so we go forward. But also, I've been trying this to face you today. Also, you can try to have your presentation in an environment in which you can also have questions from the audience and fear a little bit the fear of the presentation. But I think that the most useful thing of the virtual reality could be in surgery. This is a nice publication of 2017 made from the U.S. general surgery on U.S. general surgery residents about their independency. What they found is that after the postgraduate year, after the first postgraduate year, they feel unfamiliar with the most 5 done procedure. And we are talking about appendicectomy, for example. But also after the residency, they have a good performance on the most done procedure, but they still feel unfamiliar with procedures that are less frequent. And we don't want to face a condition like this. We should be trained before the procedure. So in the reason of that, there are still now a lot of procedure that you can do virtually in order to acquire skills and repeat the movement anytime you want to create more fast learning curve. But not just in standard cases, now they're doing a lot of stuff.